Welcome everyone to the Colloquium of the Weizsäcker-Centrum of the University of Tübingen. We are delighted that our speaker today is Professor Mathias Frisch. Professor Frisch is the director of the Institute of Philosophy at the Leibniz University, Hannover. He is famous for his work in philosophy of physics, general philosophy of science, and philosophy related to climate change. Professor Frisch is the author of 2 books in philosophy of physics, published by Oxford and Cambridge University Press. He is also very active in the philosophy of science community. For example, he is currently the treasurer of the European Society for Philosophy of Science and will soon assume the position of an editor-in-chief of the European Journal for Philosophy of Science. Recently, Professor Frisch and his collaborators got a grant from the Volkswagen Foundation for the project related to pandemic policies, and today he will present some of the results from this project. Please.
Okay, well, thank you very much, Vlasta, for this very kind introduction. I will share my screen and then begin the talk. So can you see the screen? Yeah, and you can hear me. All right, so yeah, thank you very much for the invitation. So topic of this talk is uses and misuses of scientific models and pandemic policy advice. And as Vlasta already said, it's see here, it's partly based on joint work with collaborators here at the Leibniz University and funded by a grant from the Volkswagen Stiftung. So I got interested in this topic, even though I'm not a philosopher of medicine or a philosopher of epidemiology. Well, because like probably most of us, we've been thinking a lot about the pandemic in the last years, reasons for various rather dramatic lockdown measures that various governments took. And there was a fairly active discussion, at least among some quarters, among philosophers, but also some very vocal epidemiologists who were critical of the measurement governments were taking, and specifically also criticized the use of models of the pandemic that scientists had developed. And so here are a number of titles from papers, a mix of medical researchers and philosophers. And in particular, here's more specifically some of the charges. One charge that COVID-SIM, a model developed by Neil Ferguson and others at the Imperial College in London, allegedly predicted widely inflated fatality rates for the UK and the US. Another charge, model predictions for daily deaths and ICU bed utilization in New York State were widely off. A lot of the criticisms were that the models were much too pessimistic, but there were also criticisms on the other side. A particular model developed by researchers at Washington University, the EMA model, was charged to be overly optimistic, at least early versions in March 2020. And finally, a certain type of models that I'll talk about a little bit about in a minute, a researcher at Stanford University charged were completely and totally wrong. So what I want to argue here is that though that these criticisms, even though they're onto certainly problems that these models had and continue to have, that these criticisms nevertheless suggest a rather narrow conception of the uses to which models, scientific models or epidemiological models more specifically may be put. Namely, it seems like all these critics read the models as predicting outcomes as precisely as possible. And what I want to argue in this talk is that models can be legitimately used for a whole variety of purposes. And in assessing the adequacy of a model, we need to ask what the particular context-dependent purpose might be for which a model is used. And so I'm referring to Wendy Parker's notion of adequacy for purpose. So what I want to do in this talk is 4 different things. First, I just briefly want to give an overview of the types of model that epidemiologists were proposing in the last year. Then I want to say something about different uses of models, different modeling dimensions, and different modeling purposes. Then in the third section, I want to concede to the critics that indeed there are problems associated with the use of models. Models can be misused. And so I want to point to a number of pitfalls in the use of models. And if there is time, as I'm keeping an eye on the clock here, I want to sketch very briefly the way in which models built from scarce data with lots of uncertainties might nevertheless play a legitimate role in policy decisions. All right, so let's start. So it's basically three different kinds of epidemiological models that researchers have built in the last year, I mean, more years before for other pandemics or purposes as well. Population level or compartment and models, individual or agent-based models, and curve-fitting models. The first type of model, the population level compartment models, are extremely simple models that assign members of a population to different subgroups. The models are deterministic, consisting of a very small number of differential equations, 3 or 4, that describe how the relative sizes of the subgroups change. SIR models assign the population to 3 different compartments: the susceptible subgroup, the infected subgroup, and the recovered or removed subgroup. The SEIR model add an exposed subgroup. So like I said, it's extremely simple model built on with the number of very few differential equations that have a very small number of parameters, such like as the transmission rate or recovery rate or latency period. By contrast, individual or agent-based models are extremely complex. They model the context of individual agents that are members of a synthetic population consisting of thousands of individuals. The synthetic population is supposed to represent as much as possible actual populations in their relative makeup. These members of the population are assigned to different locations, be it the workplace, be it the home, or some other general community setting. And then one models contacts among these individuals to model transmission events. These models may be deterministic, but they also may be stochastic. If they're stochastic, then of course you have to run the model very many times to get some kind of probability distribution for certain courses of the spread of the virus. So how the infection rates rise and then drop again. Finally, the third type of model, among them is this model developed by the EMA Center in the University of Washington. The EMA model developed by University of Washington are curve-fitting models, and these models basically make no, at least in the kind of most pure case, make no assumption at all about the mechanism by which the virus spreads, but simply look at how infection rates rise and then fall at various locations like Wuhan or northern Italy, try to find some kind of best fitting curve to the infection scenario, and then use that curve to predict the course of the pandemic at some other locations. Okay, so this is just very brief, some details on what kind of models people built. Now, modeling a pandemic is very hard. I found this, I thought, very useful graphic in an article at the website 538, the statistics policy website by Nate Silver in the US, an article why it's so freaking hard to make a good COVID model. I mean, there's all these different quantities. If you're interested in modeling the number of dead, which is a function of the susceptible population, the infection rate and fatality rate, all these quantities or variables depend on lots of other quantities, which are often extremely difficult to estimate, which vary widely across a population and within different subpopulations. So just zeroing in on one part of this, if you're interested in the infection rate, well, that's going to depend on the contact rate, but contact rates vary widely from one population to another within different subpopulations. They will, of course, be affected by policy measures, but then how they will be affected depends on how much people comply with the policy measures, how they interpret various policy measures, and so on. Transmission rates vary from individual to individual, and so we have this incredibly complex system of quantities that are very difficult to determine precisely or to estimate very well. Okay, so if you have a model, if you have a situation like this, it seems clear that it would be very difficult to represent all these factors in a model accurately. But if you think about it for a minute, or maybe by now an obvious point, you'll realize that not only is it difficult to represent all the aspects of the pandemic in the model, but it's simply impossible to build a completely perfect model. So this is a point that for now has been made in philosophy of science for several decades. Nancy Cartwright in the 1980s was one of the philosophers who make this very forcefully, that all models need to idealize and abstract in some ways. There simply is no perfect model. So, but a corollary of this is what counts as adequate precision for a model or adequate level of detail is dependent on the modeling purpose and the context of use. So depending on context, the demands on idealizations and abstractions can be quite different. If we want very precise, fine-grained predictions, we might want a lot more detail in our model. We might think that certain idealizations and abstractions are inadequate because they don't allow us these very precise, fine-grained predictions. On the other hand, if we're only interested in coarse-grained predictions, qualitative predictions of the shape of a phenomena or just the order of magnitude, much more dramatic idealizations or abstractions might be okay. And as I'll say in a minute, there might be actually advantages to have extremely highly idealized models of a certain phenomenon. So the level of idealizations and abstractions is kind of one dimension along which you can assess models. And as I said, it's highly context dependent and purpose dependent what kind of level of idealizations and abstractions will be adequate. There are other dimensions along which to evaluate the adequacy of a model. Namely, models can be used for very different purposes. Models can be used for other tasks than simply predicting the actual value of some kind of quantity as precisely as possible. So one distinction that's often made in the philosophy of epidemiology literature is between the terms of prediction versus projection. So prediction or forecasting is in fact predicting actual values of quantities, but distinguished from this has to be the task of projection, where we're interested in statements about counterfactual outcomes or conditional outcomes, conditional on certain inputs, which will generally not be actual values. We're not only interested what happens in the actual world, but often models are used to make these kind of projections. And a third task is models obviously are used for explanation to represent causal relations or mechanisms. And as I'll also say in a couple minutes, these tasks, particularly the explanation and prediction task, might come apart. A model that's best suited for one task may not be necessarily best suited for one of the other tasks. Now, I want to spend a bit more time now talking about models as projections to argue that we shouldn't only focus on see the output of a model. So look at what the output of a model is compared to the actual world. If it doesn't match, say, okay, this model failed. So why should we be interested in projections? So conditional outcomes, conditional on certain kind of inputs that in general will be non-actual inputs. Well, the first point, reason why we should be interested in projections, particularly policymakers should be interested in projections, is obvious. Policymakers need conditional projections rather than unconditional prediction of actual outcomes as input when deciding on public policy measures. They want to know what would happen if they were to adopt a certain policy rather than what will happen in the actual world. And this is a point Andrew Schroeder made in a paper last year. Predictions, in fact, aren't all that helpful for policymakers because predictions already have to include assumption about what policy choices the policymakers in fact make. And that's not something the policymaker, it's helpful for a policymaker. A policymaker has to decide what would happen if she were to adopt a certain policy. And in reading Andrew Schroeder's point, I got reminded of what Frank Ramsey called the ultimate contingency. This is a point Hugh Price is very fond of making, or a reference Hugh Price is very fond of making. Frank Ramsey argued that in deliberation, we need to take our decisions to be free and probabilistically independent of their own putative causes. So I can't already put into my decision probabilities of various policy measures I might adopt. Other reasons why projections are useful and helpful. Well, projections allow us to derive ranges of possible or plausible outcomes given different initial or input states or boundary states or whatnot. In particular, among these ranges of outcomes might be plausible worst case outcomes. So if we use projections to derive worst case outcomes, we can use these as inputs in some form of precautionary reasoning. I mean, whatever precise form that might take, and I'll come back to that at the end of the talk if I have time. So in this precautionary reasoning, we could, in a decision procedure, try to decide on policies that aim at pruning away the most catastrophic branches from the trees of branching future trajectories that the epidemic or pandemic might take. So we don't know what will happen. We also might not even know with what probabilities a certain outcome would happen, but we know plausible futures, and our decisions might be aimed at pruning away the most catastrophic branches here. Third task that where projections are useful, by answering what if things had been different questions, and this is a term coined by Jim Woodward in his book in 2001, but also in earlier papers. By answering these what if things have been different questions, we can probe for causal dependencies and causal mechanisms. So the idea is, if with Woodward and many others, we adopt some kind of vaguely counterfactual account of causation, or at least believe there is a strong link between counterfactual notions and causal notions, then considering these kind of what if things have been different questions that projections allow us to probe, we can probe for causal dependencies. And we can do so even, or perhaps especially, under conditions when significant aspects of the complexity of the causal web in the world are ignored. So when we build very highly abstracted or highly idealized models. And in fact, it seems to me, if one compares very complex models of a phenomenon like these agent-based models with these very simple compartment models, one is they allow us to probe for causal dependencies on different levels. Population level models allow us to make causal claims at a population level, individual-based models at individual level. The second point, though, is if these highly detailed models get too complex, it might sometimes even be difficult to trace the causal dependencies. And I think this is a case that sometimes be made in another case modeling context, the climate modeling, that highly abstract, highly idealized models give us access to an understanding of the causal mechanisms governing the climate system that these super complex general circulation models, global climate models, might not be able to do, because there's just too much complexity in them that it's very hard to follow. So there's a sense in which actually explanation and prediction can come apart, that a model can be explanatorily informative, even though it's so idealized that it might not get all the nitty-gritty details of the predictions right. But on the other hand, a model might be so complex that it might be good for predictive purposes, but it might be harder to draw some kind of explanatory conclusions, inferences from the model. So there's a role for something like a modeling hierarchy or modeling at different levels of abstractions. Another purpose for projections, in the case of highly uncertain parameters or uncertain parameters that we use as inputs in our models, and this is clearly the case in the case of the corona pandemic, we can use projection, we can analyze projections with different input values for the input parameters to perform robustness analyses. So you might ask, and so this was one of the criticisms, I guess I'll get back to that, this COVID sim model was built with all these they were totally speculative, the parameter inputs. Well, one thing to ask is like, well, let's look at the parameters in this model. And thankfully, sometime later last year, there was a robustness analysis of this COVID sim model. This was one of these influential models by the Imperial College, where they first found that, in fact, there is a very small, even though the model has, dozens of parameters, an extremely large number of parameters, there's a few parameters that seem to very much drive the predictions. And for those that seem to be the most important ones, they found that if you vary these few parameters within the range that is plausible, here's the second sentence, is the important one. Most of the probability mass contains predictions within an order of magnitude similar to those predictions published by these early model runs by Ferguson and others. So the claim is, look, we might not know what these parameter values are, but if we're only interested in order of magnitude predictions, it doesn't matter. We get the same order of magnitude if we vary these parameters within plausible ranges. Another thing, and this is not the main point here, but is, if some of you have followed these criticisms, there's this criticism that this Ferguson model was wildly too pessimistic. Actually turns out in this robustness analysis, this yellow curve is this dash curve is in fact the values that Ferguson published. That's in fact at the lower bound of this probability range. And not just that, the whole probability range is outside of the death toll, the fatality rates early on in the pandemic. So the model was in fact much too optimistic rather than too pessimistic, at least if this analysis by Edeling and others is to believe. Okay, now the last point, so I made much of this distinction between projections and predictions. I want to kind of qualify this because I also talked about the role of idealizations and abstractions. In fact, strictly speaking, all modeling results are projections, because all modeling results all models invariably involve non-actual counterfactual assumptions about the structure and dynamics of a system, just because all models have to idealize and abstract in some ways, and then they project how quantities characterizing this system will evolve under these assumptions. Now, a projection can be used as a prediction if we take the idealizations and abstractions to be such that in a given context and for a particular purpose, the model's projections allow us to make predictive inferences about the actual world. So for example, you might say the Ferguson model is useful as predicting order of magnitude effects. Maybe it's not useful at predicting precise numbers. So to what extent and how you use this kind of projection as a prediction depends on the context and on an assessment, how you how you assess these idealizations and abstractions in the model. So what kind of precision can we expect in light of the abstractions and idealizations we've chosen, and in light of the uncertainties associated with input parameters? Okay, so this was a, it maybe took me a couple of more minutes than I thought it might, overview of the role purposes models can be used for, and particularly if we use models for projection, what can we gain from those? So a lot of, now I want to briefly take another look at the criticisms that are cited earlier. So first, the model by Ferguson from the Imperial College predicted widely inflated worst case fatality rates for the UK and the US. Well, in fact, they predicted, in scare quote because it wasn't a prediction, 2 million US deaths with no policy interventions and 500,000 UK deaths with no policy interventions. But what that was a worst case projection, importantly, abstracting, as they explicitly point out, from any spontaneous changes to behavior. So the idea was, this is what would happen if there were no government interventions and nobody adjusted their behavior spontaneously in light of rising fatality rates. And as they themselves point out, this is an unrealistic assumption. Even if the governments hadn't done anything, people would have adjusted. And I mean, there's evidence that people in fact did adjust their behavior, often prior to policy interventions. So you might say, well, what use does this play, this kind of model run? Well, I think in some ways it might help to anchor our perception of the severity of the threat. I mean, of course, people would spontaneously change their behavior if things got really, really bad. But I mean, at least here's some kind of absolute worst case that kind of anchor our perceptions. Just as a complete aside, it's with some hindsight, it's unclear how, if anybody could think that these numbers were extremely exaggerated. Now a year later, actual fatalities in the US are actually a third of this worst case projection with no interventions, no spontaneous behavioral changes for the US. So, I mean, I'm not an expert, but it strikes in what to read off of this, but it seems now we're in the same order of magnitude, given that there were obviously in wide areas of the United States, very massive policy interventions during the last year. In the UK, I mean, there was a massive policy interventions, lockdown measures for much of the year, and still was a quarter of the number predicted. So it doesn't seem so terribly exaggerated anymore, look with some hindsight. But I think the important point, though, is that it's really, one needs to realize it was a projection, and it was a projection that abstracted away from any spontaneous changes to behavior. Actually, this other quote I had earlier from the Stanford economist Cochrane also focuses on this role of endogenous effects and says these SIR models are completely and totally wrong because they don't include endogenous effects, that is, effects of people spontaneously adjusting their behavior, not in response to policy interventions. Yes, I want to say that's right, but so that they don't. So if you used the output of these models as a prediction, then it's going to be unrealistic or implausible. But I think what these models, these projections, can be used by running them without endogenous effects. They can be treated as providing population level causal information concerning the effectiveness of certain behavioral changes. And again, what is abstracted away from is the difference between, are these going to be spontaneous behavior, are these policy interventions? But you can see as, what would happen if the transmission rate changed in various ways. You can see what effect that would have on infection rates and fatality rates. So again, I think treating this as a prediction, yes, it's completely and totally wrong, but that's probably not the way it's supposed to be used. Why not include these endogenous changes? Well, I'm not quite sure, but one is there's a couple of reasons maybe why not. One is that they're incredibly difficult to estimate and extremely context dependent, not just on place, but also on time. I think the way the populations have adjusted their behavior was very different early on in the pandemic. How we all reacted to policy measures. 9 months later, I think we were all somewhat tired and were probably not reacting in the same kind of dramatic way to it. So these endogenous changes are extremely difficult to model. There's another fact which I think is kind of an interesting thing to point out. That's another paper that we at the University of Hannover just got accepted. That in some ways epidemiological models might be performative, and that's a notion coming from the philosophy of economics. Models are performative, or theories are performative if they influence their targets in certain ways. In particular, these models may change individual behavior through information conveyed to the public. If the results disseminated to the public point to a very dire picture, then people are likely to adjust their behavior, especially if they're widely published, more dramatically than if the model paints a very benign picture. So there's this interesting looping effect, and so here I'm alluding to a notion that Ian Hacking coined, this interesting looping effect that some of the parameters in the model might be affected by how the model is disseminated to the public and taken up by the public. So again, make it somewhat harder to use these models for adequate predictions. Finally, I mean, this echoes the point I made a little earlier, that these parameter choices are speculative and where predictions were off by up to 200%. This paper by researchers involving Stanford, John Ioannidis. Well, that's right. It would be a mistake to use these models as providing reliable, precise numerical predictions, but in situations characterized by lack of data and certain modeling inputs, the models may nevertheless be useful, it seems, if understood as providing coarse-grained, qualitative order of magnitude predictions. So in fact, Chin and others argued the models failed because they were off by a factor of 2 in some very small time window, maybe a factor of 3. You might say, well, in a way, this shows that the models did what the most one could have hoped from them at this point, namely giving an order of magnitude prediction of effects. So they might support qualitative conclusions like, and I'm taking this from a paper by Jonathan Birch, that only suppression can prevent hospital resources from being overwhelmed. So what you need for this is some kind of numbers that are within the right order of magnitude. What you don't need is precise numbers. And so being off by a factor of 2 might not be so bad for those kind of qualitative projections. All that being said, so I say, okay, you can use these models and can legitimately use them to generate coarse-grained predictions, projections, some kind of causal information. Nevertheless, there are several pitfalls with using these models. And I think not just the detractors of these models might have been led to misread or misuse them, but I think they're very commonly models are misused or misread in these ways. And so here's a number of these pitfalls. First one is that very often, the numerically precise outputs can take on a life of their own, and hedges to the precision tend to fall on the table and be ignored. I mean, actually, there's unfortunately no time for this, but I could tell you several stories from examples of this from climate modeling, and not just from transferring information from scientists to the public, but even within scientists. So when scientists, you have a certain kind of model, you spits out certain kind of numbers, and then there's all these hedges about how uncertain they are and how qualitative they are. Then some other scientist picks up this paper and feeds it into a model of him or herself in a group of scientists. Very often it seems like what's taken up is the number, and all the hedges and all the text around the number seems to be forgotten. So in a very recent paper also on COVID-19, Stephen John and Emma Curran say this, and it seems exactly right: precise numerical reasoning tends to crowd out more complex qualitative reasoning, especially when estimates are spuriously precise. Now, the problem, of course, is models do spit out precise numerical numbers. So you could say it's almost reads like what John and Curran are saying, well, maybe we should kind of ignore these because they spit out the numbers, but I think the numbers are nevertheless useful. And so I just actually want to present a dilemma here without giving you any answers or some way out. Maybe there isn't one except for some kind of hand-wavy qualitative solution to it. Namely, there seems to be a certain dilemma for how scientists should report or communicate modeling results to policymakers. On the one hand, there's this worry that even if the numbers are qualitatively hedged and you say, okay, here's the model output, but here's all these uncertainties and blah, 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 that what really sticks is the number. So there's this, you get this sense of fake precision where there really isn't any. Yet on the other hand, if you say, well, let's not report any numbers, it seems like numbers have a certain way of motivating people to act in ways in which maybe purely qualitative projections might not. So having this number of whatever 2 million deaths, even though, as we said now, it has to be read in a very different way from this is the prediction what will actually happen if. So having this number, I think, has a much greater effect on the general public and policymakers than just kind of a very long-winded qualitative account of the course the pandemic might. And so I think this is a dilemma. And so I don't know how to solve that. I mean, you have to, maybe one has to take extra care of reiterating again and again the hedges. Of course, then the worry is if you do that too much, the numbers no longer have the effect they have. So I think there's a very difficult balancing act that scientists have to do there. Somehow related, stochastic models spit out probabilities. These probabilities, however, are probabilities in the model. They're not decision relevant epistemic probabilities. They're not the kind of probabilities that can be fed into a cost benefit analysis or expected utility calculation, because they're conditional on all the modeling assumptions. So to get from these model-based probabilities to some kind of probabilities that decision makers could use requires some kind of extra step, where it's also rather unclear how that, I mean, if there is a precise way of doing it. So we're entering then, I think, the area of qualitative assessment. And I think that's this kind of problem is one, I think, that's rampant in the climate modeling literature and what to do with climate models. You get these probabilities that the models spit out, and then very often they're taken to be the probabilities we have to base policies on, with the big worry, I think, that often the people end up being much too optimistic because there are certain kind of often tipping point behaviors and blah, 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 that's not included in the model. So often there is tail risks, so at the most severe risk, that aren't going to be represented by these model-based probabilities. So there's another pitfall. How do you go from, but it's again kind of numbers take on a life of their own. These models, you get numbers out of them, but they're not the probabilities we should base our decisions on. In fact, actually in COVID, some people have argued the same thing, that there's tail risks, that things could be always much worse than we expect them to be, and that those are not included in some of the probabilities. Okay, another pitfall is that in building our model, we need to assume certain conditions, constraints that aren't included in the model, under which a certain abstraction idealization might be legitimate. Often these are easily forgotten because they're not included in the model, and so you might think that the model is applicable much more widely than it in fact is, because you're ignoring the constraints. And there's a very nice paper by Nancy Cartwright on evidence-based policy, where you can actually, they parallels very nicely, I think, that this discussion, that the points I want to make here, where Cartwright speaks of support teams and ladders. So support teams are these assumptions you need to make about of certain parameters you put into your model. And it's very easy to forget that there's substantive assumptions going in making these choices. And I'll continue this discussion a bit. In the case of very highly idealized models and very abstract models, I already said this earlier, an advantage of them, they allow us to represent fundamental mechanisms in a particular perspicuous manner. And the hope is that even though they don't have all the details, then to give you a precise prediction of the course of a phenomenon, they at least give you the qualitative shape. And you might think, because it's very abstract, it tends to be much more generally applicable in many different concrete circumstances. And again, an example from climate change, there's these zero-dimensional energy balance models where they're extremely highly idealized, and they give you kind of a basic sense of what happens to our climate system. And you could think these SIR models do the same thing for the COVID pandemic. Now, okay, so I'm looking at the time, but unfortunately, I won't get to the last point, but I was worried I might not get to this. So I'm going to conclude this section with modeling pitfalls for another 5 minutes or so, and then I'm going to be done. As I said, it's very easy to forget these precise, forget the conditions under which these idealizing assumptions hold. And moreover, sometimes it might actually be the case that your highly idealized projections, because they ignore some of the nitty-gritty details, might even be qualitatively wrong. And so here's a really nice example from the epidemiologist Mark Lipsitch that I heard him present at a talk at Pittsburgh just a couple of months ago. So this is the wonderful thing about Zoom talks. You can go to talks everywhere in the world. So what he said is, and so I would have another example from climate modeling, but I'll take this one because it's more accurate. So what he said is that, he's interested, so they were interested in his research group, how one should allocate vaccines under conditions of vaccine scarcity. And of course, there's an ethical dimension to it. So what the industrialized nations are doing right now is clearly unethical or immoral by not giving enough vaccines to less developed countries, at least I would say. So, but there's this ethical dimension. But then you could say, well, maybe there's just a pure optimization problem also. What should you do if you want to contain the spread of the virus as much as possible? And I can't tell you the details because I don't think I understood it quite, but I can tell you the outcome. What they found is that there is a certain model that surprisingly shows you, I mean, you kind of morally want an equitable distribution, but that shows that a non-equitable distribution is preferable from an optimization standpoint. I mean, I guess the idea is you want to give the vaccines to those countries where you have the worst outbreaks or something like that. So there's a non-equitable distribution that's preferable. And then I think the way Mark Lips's report is says, okay, that's way too bad, but I guess that's the way to go. But then they noticed that there's an assumption going in here, namely that the populations are homogeneous, that you don't have different subgroups of a population that are more vulnerable. And as soon as you de-idealize here and say, well, we don't have homogeneous population. In fact, for COVID-19, we have extremely unhomogeneous populations. The elderly are much more vulnerable. It actually turns out an equitable distribution is optimal. At least this is what Mark Lipsich reported. And I think what's nice, what it shows is this an example where you have a very abstract, highly idealized representation of a phenomenon. You think that if it doesn't get the details quite right, it gives you at least the qualitative shape. But it need not do that. And like I said, there's other examples, of course, that. So you need to add more causal detail, more kind of details to the picture, then completely switches around the qualitative assessment. But then you don't know, is that the right one, or where's the right level of detail to stop? So modeling is tricky. A lesson to be learned from all these pitfalls, and this kind of hammers away the original point that you can't just simply read off from a model, what's the number, read that as a prediction, check it against the actual output, and then say, okay, well, the model's failed if it doesn't match. What the lesson I want to draw from this is that experts are needed to very carefully curate modeling outputs. The question of, first of all, how to package and pass on numerical outputs to policymakers and the public, how to move from model-based probabilities to decision-relevant assessments of degrees of plausibility, judgments of when a modeling result is applicable in a given context or model relations are projectable onto a given context, when are boundary condition constraints appropriately similar, and note just these kind of judgments, this is the last kind, you even need those for these kind of apparently non-theoretical curve fitting approaches, because if you want to kind of what the EMA model fit for Wuhan or Northern Italy, if you want to apply this to whatever New York or Spain or whatever, you need to ask, well, is the situation relevantly similar that this kind of model fits there? Okay, so what I would have wanted to tell you in the last few minutes, I'll just give you the one sentence thing, is that in light of this, I think the models didn't fail. They were very useful in giving us coarse-grained qualitative information about plausible trajectories for the pandemic, and the way to use them then would have been, or I think that was actually what was done, is feed them into some kind of broadly precautionary reasoning, and to kind of try to prune away the worst catastrophic outcomes. And of course, it's a difficult question whether we succeeded or we failed. I would have had some sentence to address this kind of obvious comeback. Well, there's also damages on the other side, and but anyways, that's for another talk or another occasion. So I'll go to the very last. Say thank you for your attention.